Good morning, everybody. Thank you very much for joining in today. Today, we are planning to have two talks on the broader theme of technology transfer and venturing. We'll have Dr. Stevens speak first and then Janak Nabar speak later. But before that, I'll request Dr. Shirshendu Mukherjee to speak a little bit about the BIRAC and NPM efforts to create a tech transfer network in India as well. First, greetings to everybody. Today is actually, we have this unique opportunity of having Dr. Ashley Stevens here in person. But beyond that, we also wanted to use this as an opportunity to bring together many of the people who are looking at the local innovation ecosystem and explore how it can be enriched, made a little more vibrant, connected, and hopefully, over a period of time, build some tools and some, processes which will help us increase the level of collaboration and as well as produce more tech transfer or technology-based technology-driven impact in this economy as well. So that's the larger intention of today's purpose. Dr. Stevens has a lot of experience in the field, and he has also watched quite a few ecosystems in action and in evolution as well. So we will get some of those insights today. For those who are joining us online, thank you very much for joining us. We just to give you a quick introduction, the Venture Center is based out of Pune in the National Chemical Laboratory campus. It's an independent, not-for-profit entity which is focused on primarily looking at technology, science and technology-based innovation and entrepreneurship. And it's an open access facility which many institutions benefit from in this region, many individuals, many entrepreneurs who are making use of it to build their own activities. And we are happy and proud to support that. We are also a hub trying to bring together several capabilities, expertise and resources to this region as well, and to the many entrepreneurs and innovators on our network. So in that context, it's great that BIRAC, the Department of Biotechnology and its arm BIRAC, which is a Section 8 independent company which works with industries and startups and companies, decided to look at setting up a network of regional tech transfer offices under the National Biopharma Mission. And there are now 7 such centers, and one of them for the West Zone is Venture Center. And we are trying to put together ways by which we can increase many more relationships between industry and academia, startups and academia, and also in many ways academia and academia, because that is also equally important. And of course, all the other possible combinations you can think of. In science-based innovation, I think without looking at the synergies of capabilities in different organizations and institutions, I don't think we can make a lot of progress. It will only be through those unique synergies that we can create great value, and that is quite clear. It has to be greater than the sum of the parts, and that will happen only through such synergistic and interesting collaborations. So that is the background for today's activities and this organization here. We welcome all of you. Happy to have all of you here. There'll be more joining us as well in a coming few minutes. We'll run first few talks, and then from there on, we'll break at around 11:20, and following that, we will have roundtable discussions here in the in-person group that's available, but the online session will stop at around 11:20 roughly. So very happy to have also Janak here. Thank you, Janak, for joining in. I must tell you that he's joining us despite not being in the best of health. And I'm grateful for his interest and his enthusiasm. But I wish he was here because he could have introduced him to many more people. But I do want many of our institutions to know Janak's very interesting activities and the kind of data that they are generating for the research ecosystem and innovation ecosystem in India. And that is very unique. Nobody else is doing it at this time. So I think with that, over to you, Kavita.
I now invite Dr. Mukherjee to deliver his opening remarks on BIRAC NBN's efforts in creating the TTOs network. Before that, a short introduction to Dr. Mukherjee. Dr. Shirshendu Mukherjee is the mission director of BIRAC. He is trained as a medical microbiologist and has global and national exposure with more than 2 decades of high-level experience in top organizations. He has worked on issues related to healthcare in India as well as across the globe, and has deep knowledge in pharmaceuticals, biopharmaceuticals, and the medtech industry globally. Before joining Wellcome Trust as a senior strategic advisor, he was staff scientist at ICGEP. He currently heads the India initiative of Wellcome Trust and manages the R&D for affordable healthcare in India. And he holds a PhD in microbiology. He's a law graduate. Has done an advanced.
That's fine. I think don't waste time.
I think Dr. Mukherjee doesn't need too much of introduction, so I'm going to.
But I think you must mention that he is leading the National Biopharma Mission right now and is also driving some of the tech transfer offices out here. So with that, I think we can begin.
Yes.
Yeah.
Thank you. I think good morning, everybody. Dr. Ashley Stephens, Premnath, and Manisha, and each and every member of Venture Center, and distinguished participants for today's roundtable. It is indeed a pleasure for me to join this interactive discussions, and pleasure to have Dr. Ashley Stephens here, one of the leading technology transfer practitioners, global leading technology transfer practitioners. He has mentored many of us in this field, and it will be very nice to have this interaction. And thanks Premnath and Venture Center for coordinating this interaction here today, and lots of people will benefit from his. We did spend around 2.5 days with him in Delhi and on Tuesday and Wednesday, discussing a lot of things, lot of learnings. We had an excellent interaction with the TTOs and also in the STEM India meeting as well. So as I think Premnath, you had very nicely summarized the entire ecosystem, bringing why we are here today and what the role the technology transfer offices are, envisaged to play in our country. And you are leading one of the flagship technology transfer offices, which has been under the National Biopharma Mission. Just to give all of you a brief flavor of what we are, what National Biopharma Mission does, and how we support this activity of technology training and management. National Biopharma Mission is a program under the Department of Biotechnology and the World Bank initiative to establish the National Biopharma Mission. Basically is to support biopharmaceutical research in respectively 5 verticals, namely vaccines, therapeutics, diagnostics, medical technologies. And final pillar or vertical is capacity building in technology transfer management, and create that capacity and that culture in India. And the idea of, and I'll speak about the TTOs, as Premnath also rightly insists that TTO has been one of our flagship verticals within the National Biopharma Mission. And why TTOs and why this capacity was put under National Biopharma Mission, and why it was felt by the visionaries within the DBT BIRAC who created National Biopharma Mission, is that has been a big gap in our country. And if you see the history back 10 years back, this concept of technology transfer, technology management, technology transfer capability, a cadre of technology transfer people was literally a big gap. Only a few big institutes used to have it, and it was, within the ambit of IITs or ISTs or bigger institutes. But rolling it out at a level where innovation can be literally taken from bench to bedside was a big challenge, because we didn't have a cadre of people who literally understand technology management and various elements of technology management, which I think Ashley is going to speak and discuss with you today on identifying good technologies, identifying innovations, protecting the innovations, then evaluating those innovations, and then marketing those innovations, and ultimately transferring those innovations so that it can reach the bedside of the field, and ultimately commercialization. This entire chain was a big gap, and that's how the National Biopharma Mission, one of the verticals, is decided to build capacities of technology management professionals in this country. And how it was done that, as rightly said by Premnath, is we created hubs of technology management centers, and 7 such technology management centers at each zone of India was created under the National Biopharma Mission. And where you are sitting right now and where you are connected with right now is one of our flagship TTOs led by Premnath and Manisha, and is one of the flagship our TTOs, which literally works around creating the technology transfer, awareness. I should say it starts with awareness and then converts it into a technology transfer movement to understand in the academic and startup and connect them to the industry which needed. So that is one of the ideas that to create. How there are 7 TTOs, as rightly said by Premnath as well. And the idea is not only to, look for identify good innovative solutions which the academic settings or a startup setting has created or innovated, but also, building them synergies, what industry needs, what the gap is, and to connect them to them. Not only that, identifying the innovation, protecting those innovations, addressing the regulatory challenges, drawing up an exit strategy, and ultimately taking them to the market. That is the whole idea of these technology transfer offices. So we are trying to build the capacities around that. I always say that if you say some 5 years back, we had only one qualified technology transfer professional in this country called the RTTP. Now we have built a cadre of around 28 of that, and many more are in pipeline to join this professional network of qualified technology transfer professionals in this country. So National Biopharma Mission, which is housed within BIRAC, as you all know, I don't need to introduce BIRAC to you all, which has been an enabler of innovation ecosystem in this country by not only funding, but creating the incubation network, drawing up business plans, helping the innovators to identify the risk areas, mentorships, and ultimately commercialization. We work around that, and it is a very right synergy that NBM has been housed within BIRAC to support this technology management movement. And so multi-prone approach we have adopted, and as rightly said, synergy is a very critical element. Unless academia has a synergy with industry, with startup, or academia synergy, and there are many more combinations rightly said by Premnath, has this to be built, and we are open to this iteration. And we have pleasure to have Dr. Ashley Stephens with us. I think we are all here to listen to him, to understand how we should manage, identify, and we should take it forward. So I think I thank Premnath for organizing this event today, and rightly so on a Saturday morning, so that everybody can join it and get benefit of Ashley's presence, and Venture Center for coordinating it. Thank you, Premnath, for the opportunity for me to speak to you all, and welcome Ashley, and thanks Ashley also for this event and giving your thoughtful, way forward to all of us. Thank you, Premnath. Over.
Thank you,
Dr. Mukherjee. Yeah, go ahead, please.
I now invite Dr. Ashley to deliver his spotlight talk. Before that, a brief introduction to Dr. Ashley Stephens. Dr. Ashley Stephens is a consultant at Carbeck, Winchester in US. Is the ex-president of USA's Association of University Technology Managers. He has led the Office of TechnologyTransfer at Boston, USA for several years, and he has been a scientist for a biotech startup and a biotech startup founder a technology transfer specialist, an author, and a lecturer. That's a very, very brief introduction. So I hand over to you.
Thank you.
Yeah. Okay.
Okay. So sorry about that. First of all, I want to thank Premnath for inviting me. I also want to thank Dr. Mukherjee. I have to say that pretty much all of my interactions with India have tracked back to the Department of Biotechnology. They first brought me to India in 2012 and 2013 and to teach courses. That was where I met Premnath and Manisha for the first time. And I have been very, very impressed with the vision of the Department of Biotechnology, leading on to BIRAC, leading on to the National Biopharma Mission, and this network of technology transfer offices they set up, which I think is absolutely the right thing for India to accelerate the development of a technology transfer ecosystem. I was very pleased at my time with first the meeting of the network on Tuesday and then the STEM annual meeting on Wednesday and Thursday to meet the people and to see how just after 2 years, this culture of technology transfer is clearly starting to take hold in India. So I'm going to talk about how academic and public sector research has the power to transform economies, nationally, regionally, locally. But there are certainly challenges in implementing this in emerging economies. And I'm going to talk about some approaches to addressing the issues. So let's talk about the impact of academic research. Here was a pilot study done in the US by the Science Coalition, which is a Washington-based coalition of 44 research universities. And here is a publication they published in 2010. Each member of the coalition nominated a few of its spinouts. 100 were selected. They found they had 163,000 employees at 81 of these companies, $100 billion in revenues at just 31 of them, the ones that were public, that they could determine their revenues. Biggest impact was Cisco, a Stanford spinout, with 66,000 jobs and $40 billion in revenues. Another way you can look at impact is product sales-based approaches. This was an approach I originated in 1993, driven by the first autumn survey, and I had predicted correctly that that survey would show $200 billion in income for 1992. This was a very politically sensitive number. The Association of American Universities, the president's organization, did not want this number to be published because they were afraid the government would say, "Oh, you're getting all this money from licensing. Great, well done. By the way, we now don't have to put as much money into NIH." So what I thought was, how can we deflect attention away from that $200 million? So I asked the question, what level of product sales does it take to generate royalty income of X million dollars? Well, it is not a sophisticated analysis. You just divide the sales by an average royalty rate and you get the answer. And we've asked economic impact questions in Autumn's annual survey since 2012. We asked what your licensee sales of licensed products, but obviously the Tech Transfer Office knows this from the royalty reports. We got a relatively low response rate of about 35%, and you can extrapolate. Autumn has partnered with the bioindustry organization to do a more sophisticated version of this analysis every 5 years or so. They call it input-output analysis. Here is the most recent one that came out earlier this year. And they found that over a 25-year period, US industry gross output increased by up to $1.9 trillion. US GDP increased by up to $1 trillion. And it supported up to 6.5 million jobs. So pretty impressive. People talk about the triple helix of the modern innovation ecosystem, the new economic model. And it is about the interaction of academia, industry, and government. government supplying the necessary policies and funding, academia turning out entrepreneurs and basic technology, and then industry taking this output to market. I think the first formulation of the triple helix came in this article in Business Week in October 1992. And it had inside this map of the hotspots that were emerging in the American economy. You have to remember, the American economy in the 70s and 80s, particularly the 70s, was not a happy place. A lot of industry had gone overseas to Germany, to Japan, and they started to talk about the Midwest as being the Rust Belt, because it had these rusting old plants that had not kept up and had become obsolete. And what was interesting about this map, as what's on it, is what's not on it. It hasn't got Route 128 in Boston. It hasn't got Research Triangle in North Carolina. It hasn't got Silicon Valley in California, because those are the old hotspots. And these are the new ones. Boomtown, Boise, Medical Alley in Minneapolis, and so on. And in it, they identified the ingredients of a high-tech cluster, a major research university, a good quality of life, because these are often not in the middle of big cities, building on local industry, cooperation between local universities, business, and government, technology transfer from the university, funding sources from the state, from venture capital, from angels, incubators. And they said you'll see phases of economic development. First, you'll see startups. Then you'll see a new division of a major US company. And then you'll see foreign companies moving in. Now, I had just got into tech transfer about a year earlier. I got into it because I needed a job, and this looked like a very interesting job. And when I started to read this and a couple of articles in the Wall Street Journal, I began to realize, as you look at the role of universities at the very heart of this, that not only is tech transfer an interesting job, but it's a very important job. So I'll give you an example, pharmaceutical industry in Massachusetts. The ecosystem, we have obviously major universities that have been pioneers in life sciences research. We have the most NIH funding of any single congressional district in the United States. We got 10 Nobel Prizes in the life sciences between 1960 and 1980 to feed into this. And we were leaders in developing technology licensing offices. Funding, Massachusetts was the birthplace of organized venture capital in 1947 with the American Research and Development Corporation. And that has spun off a substantial number of venture capital firms to fund all these startups. And proximity to Wall Street was a step and a plus. It's a lot easier for us to catch the shuttle down to New York City than for biotechs in California to fly cross country and basically take 3 days of their life to hit Wall Street. I think one of the most important contributors to the emergence of biotech in Massachusetts was the academic medical centers, this uniquely American concept of a large teaching hospital which does not only clinical research, but basic research that is part of a major university. And we have 4 medical schools in Massachusetts. We have the Harvard Medical School, which has all these teaching hospitals associated with it. General hospitals like Mass General, the Brigham, Beth Israel, and then specialty hospitals, Children's, the Dana-Farber Cancer Institute, Mass IDEA, Joslin Diabetes Center. We have Boston University. It has 3 affiliated teaching hospitals. We have the University of Massachusetts with 2, and we have Tufts, which used to have 3 or 4, and a lot of them have left them and have joined BU and UMass. So in the 1970s and 1980s, the university spin-outs led. In 1975, Massachusetts was a high-tech economy, not a biotech economy. There was only one major pharmaceutical company in Massachusetts. That was the US headquarters of Astra AB of Sweden before the merger. Had this very futuristic campus out in Westborough, Massachusetts. And when AstraZeneca wanted to come and put a research center here, it ignored this center in Westborough and went to Route 128. About 1978, biotech companies started to spin out of Harvard, MIT, BU, Tufts, Biogen, Genetics Institute, Genzyme, Serogen. By and large, they were know-how spin-outs. The universities they spun out of really did not have patents in the field, but they had very trained advanced scientists. Some of these companies succeeded and are still independent, Biogen and Vertex. Some stumbled and got acquired. Genetics Institute lost the US market for erythropoietin to Amgen in Federal District Court in Massachusetts, no less. And so Genetics Institute got acquired by American Home Hospital Products, which became BioRich, then got acquired by Pfizer. Some succeeded and still got acquired. Genzyme getting acquired by Sanofi, despite having grown to $4 billion in revenues. The Massachusetts Biotechnology Research Park played a very important role. It was established in 1984. It was the first biotech-specific research park in the world. It was opportunistic. There was a bunch of former state mental hospitals that were no longer used, were shut down, that were state-owned, that had plenty of real estate in good places, and that was what was used in Worcester. Happened to be across the street from the University of Massachusetts Medical Center. Its first building had Cambridge Biotech Corp, which did AIDS diagnostics on floors 1 and 2. And on floor 3, which was not-for-profit funded, there was an incubator which spawned the companies that went into the subsequent buildings on the park. Here is the original building. BASF was the first major corporation to move to Massachusetts, 1989. And it went to the Mass Biotech Research Park. We built a gorgeous facility for them. The reason it came was there were highly restrictive recombinant DNA rules in Germany, drove all big 3 drug and chemical companies abroad to do their recombinant DNA work. BASF invented Humira in Worcester, and Abbott bought BASF Pharma in 1999. And so now AbbVie has a major presence. The next thing that happened was the rise of biopharmaceutical manufacturing. Biopharmaceutical manufacturing, I think, is inherently much more closely tied to the research and development of biopharmaceuticals than small molecule drug manufacturing is tied to the discovery of those drugs. And Genzyme received substantial incentives to produce its first major product in Massachusetts, in this gorgeous building at Ulster, Cambridge on the Charles River, which they've now sold off to a contract manufacturing organization, National Resilience. And this is a slide I put together of all the biotech and pharmaceutical companies that have a product on the market that are in Massachusetts. And this slide is out of date, and I've given up on trying to keep it up to date. But I read the other day that 16 of the world's top 20 pharmaceutical companies have a presence in Massachusetts. So we've seen this transition from high-tech to biotech. I think Massachusetts is the undisputed leader in biopharmaceutical innovation in the world now. It took 40 years. It took an ecosystem, and it was led by academic technology spin-off. Now, I've identified issues that are implementing tech transfer in emerging economies. I've had the good fortune to have a fairly significant number of international teaching and strategic advisory assignments. And I summarized my findings in this article in Nature Biotech from, I think, 2015 or 2016. So some of the issues I've identified in developing countries. First of all, the good news, innovation is everywhere. However, I've identified that universities frequently lack research scale in many countries. And technology transfer, unfortunately, has a really terrible business model. Also, I found the triple helix model frequently isn't understood. I want to say that is not the case here in India, because through the Department of Biotechnology, the Indian government clearly does understand this model. However, companies don't look domestically for innovation frequently, and licensing experience isn't a major part of commerce. Commerce tends to be product-driven, not technology-driven. And there are issues with the availability of risk capital, and legal structures may not be suitable. But local expertise does grow from the ground up. And the challenge is keeping the local stars local. How many Indians have I met in America who's told me, yep, I came here for graduate studies and stayed? How do we get them to come back? It's an issue, and if we can create a flourishing ecosystem that is as good as they're going to find in the US or Europe, they will come back. So innovation is everywhere. I mean, the current generation of students, even undergraduate students, is highly entrepreneurial globally. Great project ideas everywhere. I've been to places like Chile, Colombia, Egypt, Portugal, Saudi Arabia. I should put India on that list. Great ideas everywhere. Once you've got the idea, the business development skills can be taught. You can't make somebody an entrepreneur, but you can show somebody how to be a better entrepreneur. IC Squared in Texas has done a lot of this work. Stanford Research Institute. Now, the issue is, of course, that somebody has to pay for this. Universities lack scale and research. In many emerging economies, the first priority for universities is undergraduate tuition, creating a highly trained workforce. And the graduate programs are much smaller. Doctoral programs are often even smaller. And the best and the brightest go overseas for their graduate training. Will they come back is the issue. So Chile, I had the good fortune to work with Autumn when they struck a strategic partnership with Corpo, which is the Chilean Ministry for Economic Development. Phase 1, we did training. Phase 2, we did strategic planning, and 7 Autumn experts were hired and paired with 15 universities and 1 government laboratory in Chile. 6 were from the US, and David Secker from the UK was one of the experts. 14 universities, 1 national lab. First, we did benchmarking. We got Chileans to fill out the Autumn survey. We purchased an additional survey questionnaire. Then we developed a 5-year strategic plan for each university and a 1-year operating plan. In phase 3, 6 additional smaller universities were added in. They were really, really small. I was assigned one whose research budget was $900,000. It had no PhD programs, and yet the government thought they could sustain a tech transfer office. Unrealistic. We found in benchmarking there was a low level of intellectual property creation in Chile. They were only getting about 600 patents per year in the entire country. And individuals were receiving more patents than companies. Last time that was the case in the United States was 1929. Relatively low level of academic research compared with the US. If Chile was a single university when we did the survey, it would have ranked 103rd in the US, which is on a par with Tulane in New Orleans. The largest, Concepcion, would rank 156th, level with the Whitehead Institute in Massachusetts. And of course, inventions are related to research funding. Research, more inventions. But Chile was more productive than the US, Canada, and Europe. They were getting 1 invention for every $1.1 million of research funding. In the US at the time was about every 2.8 million, Canada 3, and Europe 3.6 million. I got to say, are Chilean scientists that much more productive, or are they just paid less? I suspect it's paid less than the productivity per unit of research activity. It's probably about the same. They had a 4% licensing success rate, which is the same as the US before Baidu. Now we have a 25% licensing success rate. We license 25% of the inventions we get. The government owned and in the US, that was when the government owned and licensed IP, and you can imagine how good they were at that. The expenditure on patents was 3 times the license income. And frankly, these are the results you'd expect for a country just starting to create a tech transfer ecosystem. It was what Denmark found when they changed the law to give ownership of academic inventions to the institution. Previously, the professors owned them. And Denmark, one of the number of European countries around the time, We saw how tech transfer had been successful in the US and the UK with institutional ownership and control of inventions. They changed the law. Denmark, they started in 2000. The results were terrible, as you'd expect, but the Danes were very smart and they collected data from day one. And the government said, well, we know we're asking you to do something you haven't done before. It's going to cost you money. So we'll support you for 5 years. And at the end of 5 years, the Danish tech transfer ecosystem wasn't self-sustaining, but they had this data showing steady improvement from year one. And they went to the government and said, look, we're not self-sustaining yet, but look, we're getting better and better. Give us more support. And the government said, you're right, gave them another 5 years. And Denmark now has a very flourishing tech transfer ecosystem. And I took the opportunity of my time in Delhi to pitch BIRAC that when the current World Bank funding of the RTTO network ends, that the Indian government has to step in and give the RTTOs a longer runway, hopefully up to 10 years. Japan, it was the same story. They changed the ownership of the national universities. National universities were arms of government. They couldn't own a patent. Anybody who was going to do something, it was the professor. They changed them into private, not-for-profit corporations in 1999, which allowed them to own patents. And the government said again, we understand this is a new cost for you. We will support you for 10 years. And at the end of those 10 years, there is a very flourishing ecosystem of tech transfer in Japan. Now, going back to Chile, the scale issue meant that the right solution for Chile was probably 2 to 3 individual tech transfer offices and regional entities for the rest. Unfortunately, Corfo didn't want to do that, and we did this. That wasn't what the government wanted. There had been an earlier regional entity or national entity called OTRI, and they had decided they wanted to go down to the institutional level. It was Santiago and Valparaiso, and included the universities which could justify their own TTO. However, they finally came to the realization that regional tech transfer offices were the solution. And just like India, there are now 3 hubs, which all of the Chilean universities belong to one of them. Now, I said that tech transfer has a horrible business model. It really does. Think about it. You want to start tech transfer in a country, well, you have to hire and pay staff. And they've got to be very special people. You've got to be people who can operate in the fog of uncertainty of early stage technologies. You have to train them to change the culture of professors and scientists who haven't had to think about the practical ramifications of their work before. And they have to start identifying useful inventions coming from their research. And then you have to pay for the patent applications on the inventions they eventually start disclosing. You have to market the inventions. And there's a couple of studies in the US show that the median time to license of an invention is 4 years from disclosure. Now, academic research is typically ahead of industry. It takes time for industry to catch up. Eventually, you're going to license 25% of the inventions, which means, of course, that you've got to write off the investment in the rest. Then you have to wait while the licensees develop the inventions into products and get approval to sell them. In the case of life sciences, that's a significant time period. And some technologies don't work or aren't cost effective. Finally, you start to receive royalties on the successful inventions. And what do? You give away between 3/4 and 100% of the income to the inventors, to the dean, to the vice president for research, to fund further research. And then you have to wait for the patents to expire. What a miserable business model. And there have been 3 attempts in the US to make this a for-profit business. They failed. The implications are that it's going to be years till the tech transfer office will be self-supporting. In the US in 2006, we found 52% of institutions spent more than they brought in. 2006. 26 years after Baidol, only 16% of institutions kept enough money out of their income to cover their operating costs, and so didn't have to go beg the president for an operating budget each year. Tech transfer isn't about making money. It's about the economy. It's part of a country's economic infrastructure. And I think government support has to be essential. Government has to think of tech transfer as part of its economic infrastructure, just like airlines and airports and so forth. And it's going to be that way for many years. So I said the triple helix model isn't understood. I think in many emerging economies, government sees universities solely as a source of skilled workforce, not as a source of innovation, entrepreneurship, and economic development. Hence, there tends to be a relatively low level of funding of research. And often university leadership doesn't understand their role in an innovation ecosystem. We find decision-making is highly centralized. In Chile, often only the president can sign a license agreement, any agreement. Imagine having to get your president to sign an MTA. God, that is going to slow things down. They're loath to delegate commercial decisions to the tech transfer office. They want central approval and support. That's wrong. This has to be fast moving. This can slow down the process. And frankly, it can result in academically driven decisions, not business driven decisions. And I can't see what that is down there. Government to be risk averse.
You can just hide it using the dots
Yeah.
on the right.
Can?
The dots on the right.
So,
Yeah. Hide video, hide floating pattern.
You do it for me.
Yeah. Hide floating controls. Hide floating meeting controls. No, below. Yeah. Thank you.
Okay, thank you. So we've also found companies don't look domestically for innovation frequently. Industry leaders in developing countries frequently look overseas for innovation and new technology. To Europe, US, Europe, they don't look at local technology suppliers, particularly not local startups. So one of Corpo's major frustrations in Chile was, Chile has a copper mining industry that is world scale. They turned to Swiss and German engineering companies to supply innovation. Universities are active in these areas, and if they're lucky, maybe the mining companies will get them to do some testing of materials and things like that. They don't look to them for innovation, although we came across innovations that solved major problems, such as water evaporation and things like this. Licensing isn't a major part of commerce. Commerce in developing countries is product focused, not intellectual property and technology focused. So there's not much expertise in licensing and transferring intellectual property. And I think a major role of tech transfer offices is to start to develop those skills, even if it means you train them, they go to industry and they don't come back. Even in the commercial sector, there's not a lot of expertise in licensing, let alone in the academic sector. LES only has 32 national and regional societies. Those in emerging economies and regions often have little activity. Members are often all lawyers, no academic representatives, a few corporate members even, no academic members. LES India, formed in 2003, has a low level of activities, 1 to 2 events per year. The last training course they put on was 2019. Risk capital is available. Angel investment is usually limited to market-ready projects, products ready to go to market. Not very useful in technology development. We found an incubator in Talca, Chile. This was in the city where this tiny university was with $900,000 research budget. But this incubator had companies with great ideas. They were fabulous, but they were raising $10,000 to $50,000 per round. Only one company had managed to raise $100,000, and that was the only one that had reached liftoff. And it was driven, it had created a Wi-Fi system for buses. Buses are a major source of transportation in Chile. There aren't any railways, and they have met a local need. There aren't equivalents of the SBIR and STTR programs. I know that's not true in India. I know the BIRAC has SBIR-like programs. As I said, BIRAC is certainly ahead of the curve of most of the emerging economies that I've come across. There are limited venture capital funds, and philanthropic sources are probably scarce to non-existent, and generally limited to basic and clinical research, not to risk reduction. Even resource-rich countries have issues, because the early stages of innovation really only need really small amounts of money to reduce risk and move you up the TLR scale. And these amounts get lost in the budget rounding of resource-rich countries. And what's much more important is how you manage that funding. It's all about progressive risk reduction, technology risk, market risk. And the skills for this sort of management may not even be available in resource-rich economies, because resource-based economies don't have to deal with market risk. Extracted, and there's a global market waiting. And it's all about engineering cost risk, which is different from technical risk of early stage technologies. And the big issue is exits. The only reason someone invests in a company is in the hope of selling that investment at a profit. They're not interested in dividends. The higher the risk, the higher the profit they want. And VCs won't invest unless they can see at least a potential 10x return on any individual investment. They know they're not going to get 10x on every one, but if they get 10x on one or two, that will give them an overall rate of return that will let them raise their next fund. There's only two routes to exit: M&A and IPO. M&A, as I said, often companies look overseas for innovation, not domestically, and are they going to buy local startups? IPO, emerging companies often have weak capital markets, particularly for development stage companies. And few companies, Chinese, Israeli, have managed to go public in the US on the NASDAQ. That is not a global solution. And expertise grows from the ground up. The people who run incubators are critical. People like Premnath and Manisha are critical. They know where the local sources of risk finance are. They're the de facto local entrepreneurship business schools. They can teach people how to pitch their company, how to write a business plan. They've seen what works and doesn't work in that country. The guy who ran that incubator in Talca was absolutely fabulous. I come across, I was in Egypt for a course, and there was somebody from St. John's University in Lebanon, TechnologyTransfer, who was an idiot. There was an incubator run by St. John's University. The manager of that incubator absolutely had it all down. Yeah. Incubators are critical in developing expertise. They know the local companies that are receptive to innovation. They can plug into international organizations, people like this. And keeping the local stars local. Best and the brightest often go overseas to graduate school, frequently want to stay and not return. There are better professional opportunities, better entrepreneurial opportunities. And it's critical to get them to come back. And so, and if they do, they'll bring back what they've learned. So some solutions: fellowships, joint projects, strategic partnerships, not-for-profit in Boston called Seeding Labs, forming a local tech transfer organization, international training. Fellowships, send people to work in a US European tech transfer office for 3 to 6 months. I did this at BU. I had a number of people come and work with me. Need some sort of sponsorship for living expenses and travel. Typical cost, probably about $20,000 for a 6-month fellowship in terms of accommodation, travel, living expenses, and so forth. The universities may want some overhead, perhaps $5,000 to $6,000 for a 6-month fellowship. They're effective. You form lasting bonds and networks. I think my connection to DBT started from a man called Ravi Dar, who had come on a fellowship with an international emerging economy healthcare professional at BU. And he asked me to take him into the tech transfer office for a couple of months. I did. And that formed a relationship that led to Ravi introducing me to DBT and the courses I first taught here. Great example. There's an opportunity to form expat networks. There may be Indians, when I go to Autumn, there's a lot of Indians working in US tech transfer offices. They may not want to come back, but they'll certainly be prepared to help. They can be your network, your entree into a fellowship opportunities. Joint projects, long-term research collaborations with the tech transfer component. So MIT had major strategic partnerships with Cambridge, UK, King Fahd University of Petroleum and Minerals in Saudi Arabia, Skoltech Institute of Technology in Russia. They regret that one now. And it does require massive amounts of government support. I'm not sure it's that cost effective. Strategic partnerships like Autumn Corfo, which requires the government to get the triple helix model and be prepared to fund it. Programs are expensive. I think the Autumn Corfo program probably totaled about $500,000 in total. Seeding Labs is a Cambridge not-for-profit. It solicits donations of surplus biomedical research institutions from companies and universities in Massachusetts, refurbishes them, donates them to academic labs in the developing world. Last time I looked, it was supplying them to 19 countries. That was their distribution. It has a fellows program. It brings them to Cambridge for a summer and exposes them to the Cambridge ecosystem. They learn grantsmanship, conduct of research, and I have given lectures to these people about tech transfer. Forming a tech transfer association brings together like-minded people. Again, it should be practitioner-driven and run, not commercial or government-run. Government support is certainly helpful or essential, and it forms a locus for interaction with government, policy gap analysis, policy development. So I think Sadhguru here organized STEM, the Indian Association, I think has a very productive and collaborative relationship with DBT and BIRAC. So I'll skip through the rest here. International training, a lot of experienced people available to provide training, low cost, $5,000 to $10,000 for a week-long course. And it's important as part of this, not continually rely on bringing in people from the US and Europe, but to start to develop the expertise locally. You know, they do say the expert is the guy from out of town with slides, but we have to start to get respect for the guy in town with slides. So transition over 3 to 5 year periods. And then, you know, I can only talk about the US legal and tax structure and how we do things to comply with those structures. And this needs to be tailored to local tax laws and legal structures. So, you know, what works in Cambridge or Palo Alto isn't necessarily going to work in developing countries. So those are my remarks. Thank you for listening.
We have our next spotlight talk by Dr. Janak Nabar. Ashley just mentioned just now 2 minutes back that you should have a local guy whom everyone listens to. So Dr. Nabar is in that category. Thank you, Dr. Nabar, for joining us.
Mr. Nabar, please.
Mr. Nabar, sorry. So he is going to talk on insights of Indian R&D and innovation ecosystem from CTIER's research. Very brief introduction. Mr. Nabar is the CEO of CTIER. He is a member of CIA National Committee on Technology and the Expert Group on Technology. He has been he is a part of the working group constituted by the Niti Aayog, which ranks the national R&D labs and develops the India Innovation Index. He has worked as an economist and investment strategist in the private sector in Singapore. And his work experience includes 2 years in the UN High Commissioner for Refugees, Serbia, where he has worked on performance and financial monitoring for NGOs.
Screen.
So with this he holds a MSc in economics from the London. Yeah. So
thank you. Firstly, thank you, Premnath, for inviting me to speak. And it's a pleasure to be here. Dr. Mukherjee, Dr. Stevens, all the members at the Venture Center and distinguished guests. So the way I will proceed with this talk is provide a lot of data on the overall ecosystem in India, which will cover public research, which will cover industry. It'll also look at and then deep dive into another study that we had done with the Office of the PSA and CII to look into about 193 public funded R&D institutes. So the first part is a lot of the data is from a publication that we come out with every 2 years. It's called the Handbook on Technology and Innovation. We're currently working on the next edition for 2023. And this is from the 21 edition. So let us start, and then happy to take questions at the end.
Go ahead. Next slide, please.
Yeah.
Yeah.
Hit enter.
Just want to set some context here. So if you look at India's spend on R&D as a percent of GDP, basically we have been stuck in a range in the last 40 years between 0.6% to 0.7%. Whereas if you look at, this compares India with South Korea and China. And if you look at South Korea and China, you find that the spending has steadily increased in South Korea and China from roughly around the same levels in 1980 for South Korea and India to almost 4.8% of GDP for South Korea and about 2.2% in 2018 for China. What's interesting here is that the purpose of this chart really is to show you that for countries that have seen very high periods of growth over 10 years, so 2 to 3 decades, if you look at the 70s to the 90s for Korea, and if you look at the 80s to the 2010s for China, this has been accompanied by huge investments in R&D. And what's even more interesting is that the private sector has steadily taken the lead in spending on research and development. The funding by the public sector actually is minimal in several of these countries. And we'll see in the next slide, maybe you can move to the next slide, that India really is an outlier when it comes to spending on R&D. It is hugely dominated by the public sector. So 52%, India's at the bottom of the chart, 52% is performed by the government, 41% by industry, and 7% by the higher education sector. Another area where India really is an outlier is that who funds research and who performs it are largely the same in India's case. Dr. Stevens talked about universities that were publicly funded. Here you find that a lot of the public funded research actually happens through several autonomous R&D institutions that are part of several ministries and key scientific agencies in India. So 52%, as I said, is from the government and 41% by industry. Okay. Now, deep diving into government spending, if you break it up, it's dominated hugely by 3 ministries and departments. That's the Department of Research and Development Organization, which is Defense Research and Development Organization, Department of Space, and Department of Atomic Energy. Now, these are largely technology focused, and they constitute almost 52% of the public funded spending. 32% are other major scientific agencies that include CSIR, METI, DST, DBT, ICR, etc. Yeah.
Next slide.
Thank you. This is really to show you the level of spending, as I mentioned, hugely dominated by 3 departments. That's DRDO, DOS, and Department of Atomic Energy. And if you go lower down, I know there's been a lot of talk about healthcare research and the pharmaceutical sector, but India spends very little on healthcare research actually, which is sad given that there's natural demand for healthcare in India. And if you compare what DBT and ICMR get for research funding it's almost 6% of national or central government R&D expenditure. When you compare this with what is spent in the US and in several other countries like the UK and even Korea, you'll find it's about 15 to 20% of their central government R&D expenditure is on healthcare. So DBT and ICMR, of course, during COVID, this is 2017-18 data, the latest from DST from their statistics. But during COVID, we did see even DRDO, DOS, several other agencies coming together to spend on ventilators and other forms of research, which was aiding the COVID fight. Moving to industry, these are the top 10 sectors globally when it comes to research and development. Of course, as expected, pharmaceuticals, biotech, technology, hardware, automobiles and parts, healthcare equipment and services, it's number 10 globally. India has a presence in just 5 of these top 10 sectors, largely missing from sectors like technology, hardware, healthcare equipment and services, general industrials. What is interesting here is, like, when we started looking at this data in 2016, the number of Indian companies that make it to the top global sectors have largely remained the same. There've been about 30 to 35 companies that always make it there, and usually the same companies. In the case of China, you see that in the top 2,500, there are 507 companies. And the same figure in 2016 was about 320 companies. So you see a huge focus on research and development by the private sector in China. Parallelly, you see a decline in the US numbers, actually. US used to be over 800 companies in the top 2,500 spenders in R&D, and now it's dropped to about 750. I'm pretty sure that the numbers would have changed even more when we're coming out of the next edition. But this is just to give you a sense of how there's very, very detailed focus on research and development that is happening in China. Just to give you a sense of who the top 20 industrial spenders in R&D in India are, the Tata Motors and Mahindra is, of course, hugely dominated by the automobile, pharmaceutical and biotech, and largely automobiles and parts and pharmaceuticals and biotech. The total spending on R&D as a country, what we spend is about 17.8 or 18 billion. To set this in context, Microsoft spends more than all of India put together, right? And if you take India's spending on industrial R&D at almost $7 billion, that's in the top 2,500 companies, we would rank number 20. So Siemens, I think, would be about slightly above India in that rank. And all of Indian industry actually spends very little compared to the top 20 global spenders on R&D. These top, that's fine. When you look at startups that have been created in India, of course, these numbers, there's been a vibrant startup ecosystem. Everyone's talking about the unicorns that have emerged now, and a lot of buzz around India's startup ecosystem, the VC funding that has been flowing in and things like that in recent years. But what we found is that a large number of these startups, now this is perhaps, we'll find that it's changing over time, but it's hugely dominated by service startups. So it's there are very few that are there in manufacturing. Increasingly, you're seeing some in deep tech that can aid manufacturing, but by and large, the startups that are emerging in India are very service focused. Of course, the reforms in defense and Department of Space are likely to see creation of a lot more drone startups to other kinds of interesting technologies that can work with both Department of the Defense Research and Development Organization as well as Department of Space. But these are two agencies that have announced the intent to open up a lot more to the private sector. We'll have to wait and see how that pans out. India is also a global hub for multinational R&D centers. Now, the sole purpose of these R&D centers is to perform just R&D. There are close to about 1,100 or so estimated R&D centers. And we wanted to look at, and this doesn't really get captured in our industrial R&D spending anywhere. It's because they're part of the global value chains for R&D. And if you look at the spending in India by these companies, you find that it's close to, that of the top 100 global R&D firms, we estimate that about 92 of them have some form of presence in India. This could be in the form of a R&D center or a subsidiary of a company that may be doing R&D as well. And 65 of these global R&D spenders have definitely a R&D center that we could identify. Now, we just wanted to focus on this because of the huge amount of expenditure that anyway, just to get a base minimum of what is likely being spent in India. And we estimate that it's anywhere between 8.4 billion to about 10 billion that is being spent by these R&D centers. When you look at patents granted by USPTO to select countries, India has been steadily creeping up. You see India there with about 5,378 patents in 2019. However, a large part of these patents are dominated by multinational corporations. So I mentioned the R&D centers that have been set up here. And if you look at the top, patentees, you'll find that they're IBM and several others who dominate the number of patents being given to India by the USPTO. So the research is happening in India, and they're being granted the patents. Now, if you look at Indian companies that are patenting with the USPTO, it's largely TCS, Wipro, and CSIR. Just to give you a sense of the patentees with the Indian Patent Office as well as the USPTO on the right. Indian Patent Office largely dominated by CSIR. These are Indian organizations. However, you can see the IITs, DRDO, of course, some companies there with the Tata Group. But one must note that these top 10 account for just 5% of the total patents granted. And 80% of patents granted by the Indian Patent Office were to non-residents. There were about 50,000 patents filed in 2018, largely again dominated by, of course, non-residents. When we look at the MNCs, as I mentioned on the right, these are Indian companies that are patented with the USPTO. But you can see that 70% of these are dominated by as I mentioned, USPTO and the MNCs and MNC R&D centers that account for over 70% of the patents granted by USPTO. Turning to institutions and number of publications, of course, CSIR as a whole ranks #1 in terms of the total number of publications generated. But if you break it down, you find that over 80% of the higher education, over 80% of India's publication output is actually, the contribution comes from the higher education sector. And mind you, as I mentioned, that the funding that the higher education sector receives is just 7% of our national R&D spending. So bulk of the funding is going to the autonomous R&D institutions, but bulk of the output in terms of publications is emerging from the higher education sector. These are top areas of publications that India is largely contributing to. We find that there are areas where very clearly areas of research that are happening now, quality aside, areas of research that are happening that are very critical to technologies of the future, emerging technologies, and clearly challenges that the global economy is also going to face. So it's on that note, I think it's something which we're pretty aligned with in terms of the research that's being done in India. Is just about of course the quality that people are going to raise. Now we also find that the industry academia collaborations are very low. It's hardly like 1.1%, for example, for electronics and electrical engineering, whereas the world average is about 4.1%. So we're clearly well below world average on most areas. Perhaps I think for all areas. I thought chemistry would be pretty good, but it doesn't seem to be. And then international collaborations also a lot happening, but again below world average on international collaboration when it comes to research. I'll now move into the study on the public research and some insights from there. This was a study, as I mentioned, of about 193 labs, 34 labs from CSIR, 73. ICAR has about 100 plus labs, and 73 of them contributed to the study. And you had about 13 labs from DBT and 17 from ICMR and 13 from DST. And the very interesting findings that have emerged from this study. And I'll just deep dive into it from the next slide. So if you look at the technologies now, of course, this is the socio-economic impact. So how many technologies were being developed that target SDGs? Firstly, I think there's a requirement to familiarize people with SDG goals. Secondly, this was self-reporting on TRL levels. So TRL 0 to 4 was for basic research, and 5 and higher was applied in services. And of course, labs were categorized based on, again, they were given the option of suggesting which category they wanted to be considered in. And then accordingly, they would respond to the questions. The questions in the survey were largely the same, maybe a few that were different, but hence we were able to actually focus on all the common questions and come out with an understanding of what the aggregate picture was. So as on the technologies for TRL 5 and higher that were being developed in 2019-20 and targeting SDGs were about 1192. Very few labs of the 193 are actually incubating startups. Only 35 said they were incubating. In fact, this was a question which many labs felt would hurt them, so they kept complaining about having it in there. And the purpose of having this question was really to say that, look, it should also be direction setting, and hopefully it's something which we can move in the direction of. And so only 35 labs responded that they were incubating startups in 2019-20. The beneficiaries of the research is largely the other government departments. Very little work being done with the NGO sector. And individuals and industry is also comparatively less compared to government departments. Now, when it comes to contributions to international policy, regulations, and standards, only 34 labs are involved in actually providing inputs into global policies, whereas 96 labs actually contributed to national policies. So a huge scope. I think the research does show that some phenomenal work is happening. It's not that it's all bleak. It's just a matter of awareness and the ability to participate in global fora and really be at the forefront of some interesting research that's happening in India, which we could also share with the global community. The total publication output for these 193 labs is about 16,202 in 2019. which is roughly about 15% of the total publication output. This is the IPR. So we did find that patent filings had slowed between 2017-18 to 2019-20. About 605 were filed in 2019-20, and patents granted were about 617 in 2019-20. Now, the filed patents account for about 2% of the total patents filed either within India or outside India. And the patents granted, that is 617, was about 8% of the total patents granted either within India or outside India to residents here. These are earnings from activities undertaken by these labs. We found that the labs earned about 5,300 crores, roughly I think about $60 million over a 3-year period, with a large chunk of it coming from consultancy fees. ARAI and several others were huge contributors to this. And commercialization has been very little, actually. The earnings from commercialization was just about 36 crores from non-government sources in 2019-20, and 31 crores from government sources in 2019-20. Training is also an important element that they seem to be involved in, and so earnings are going up from there as well. Sorry, yeah, you can move to the next slide. The collaborations on industry, international and national industry collaborations, of the 193 labs, just 15 laboratories were involved in international collaborations with industry, and just 73 had collaborations with industry nationally. When it came to academic collaborations on projects, just international collaborations were just 1.1% to 1.2%, whereas national collaborations, so collaborations with higher education institutions, were roughly about 13.7%. This is the median share of the total projects, 13.7% in 2019-20. Looking at the organizational effectiveness and institutional capabilities of these firms, several of them actually reported very little spending on R&D and S&T in the overall budget. So despite every effort to define what constitutes R&D and S&T spending, the median share actually was quite low. So it's difficult to know whether this is just an issue with understanding the question, or it's actually this low, because several of, as I mentioned, I mean, the bulk of public R&D spending does happen through these laboratories. There's a critical need for diversity cells. Only 35% of the labs actually had anything to do with equity, diversity, and inclusivity. 65% of them did not have any EDI cells. When it came to share of scientific staff, about 54.1% of the staff are researchers of the total staff. And you do find that over the years, several of it's almost that there's been a huge increase in project staff compared to permanent staff. And another interesting fact is that 62%, the median share of young researchers, so young researchers under the age of 40, are at these laboratories. So 62 to 63% is what we found. And women researchers was about 30%, the median share. Now, just the last bit on training. We good, yeah. The training has, spending has been increasing, but if you look at it in the context of the overall budget, it's actually less than 1 to 2% of the overall budget. So this is another critical area, of course, on technology transfer being one of the areas, but I think overall training for budgets have to be looked at closely. Several of these laboratories do not spend enough on training of their staff. This is just to kind of sum it up. When we looked at where all, if you look at the DSR recognized, that's the Department of Scientific and Industrial Research, recognized R&D centers, and 75% of public funded R&D institutions. 90% of these DSR recognized R&D centers and 75% of public funded R&D institutions were in just 12 states. So 12 states actually dominate 80% of incubators in the country, 97% of total patents granted by the USPTO, top 10 destinations for FDI, and funding received for startups. So it's, one needs to really think about how to spread our innovation ecosystem to benefit the wider economy. And hopefully that's something which going forward we can look into. So this is it from me.